Les habla Pocho Salcedo y damos la bienvenida a nuestra audiencia en Latinoamérica, en el continente africano y los Estados Unidos. Una vez más, explorando con ustedes el ADN de las noticias regionales e internacionales. Es difícil imaginar que una crisis que ha cobrado la vida de más de 450,000 norteamericanos desde principios de esta década, un número muchas veces más alto que todas las bajas sufridas en los Estados Unidos en la guerra de Vietnam, haya sacudido de tal manera a la nación y que se declare una emergencia de salud nacional y que ahora sea sujeto de intensas discusiones y acciones de los poderes federales y estatales y el Centro de Acciones Legales por muchos miles de millones de dólares buscando soluciones y culpables. Hoy hemos invitado a representantes de dos organizaciones del más alto nivel para desmenuzar este complicado tema, desde el punto de vista de la adicción en sí misma y desde las responsabilidades legales emergentes. Analizaremos este tema. Comenzamos con nuestra primera invitada, Emily Piper. Emily Piper from St. Paul, Minnesota. Welcome to the program.
Thank you for having me.
Emily Johnson Piper, ex jefa del Departamento de Servicios Humanos de Minnesota, se une a la Fundación Haysdale Betty Ford en el papel de Relaciones Gubernamentales Center City, Minnesota, buscando expandir las colaboraciones con los gobiernos estatales en soluciones a las crisis de adicción de la nación. Piper obtuvo una licenciatura en Biología de la Universidad de St. Thomas en St. Paul y su doctorado en Derecho de la Facultad de Derecho de la Universidad de St. Thomas.
We're very much looking forward to your views on this national predicament, and I will start right away with the first question. We often make reference to the staggering number of deaths in the USA as a consequence of the opioid crisis, currently devastating this country, but that is the visible result. How did we get into this national drama?
Well, one of the issues that we have is that this really started and began at the same time as the FDA in the United States legalized and approved OxyContin to be prescribed by doctors all across the country to help people manage their pain. And so this all started many years ago in a really insidious way in doctors' offices where people trusted that opioids were going to solve their problems and solve their pain problems, and they didn't know the risks or any of the issues with the pain medication because it was intentionally hidden from them and from everyone in order to sell more pills.
Well, we see that the estimated economic burden of this crisis is of around $78.5 billion a year. However, this hardly tells the story of misery. Tell us about the impact of this crisis in families, relationships with the workplace, the human factor of this situation.
Well, it's hard to find someone at this point in time whose life hasn't been touched by this crisis, especially in the United States. We see families ripped apart. We see for the first time ever, the number one reason that kids are removed from their parents' care is because their parents have a substance use disorder. Those kinds of impacts are going to have lasting effects, not only on the person who's suffering, but also their entire families, their spouses. They lose their jobs, they lose custody of their kids. Communities are suffering, not just financially, but from the pain that this has caused, with first responders experiencing trauma associated with having to come in and revive people that have overdosed on opioids and other drugs. And so, yes, the financial burdens are tremendous and staggering. And I think the other impacts are equally, if not greater, for people in our communities, especially the youngest in our communities who are going to be living with the impacts of this for the rest of their lives.
The Hazel Dent Betty Ford Foundation is deeply inserted in this crisis, and you're offering not only recovery services to countless of those addicted to opioids, but also you're presenting for national consideration policy solutions. What do you propose should be a right approach to the already population that's addicted, and how do we prevent new generations coming into the ranks?
Well, at the Hazelden Betty Ford Foundation, we're the largest nonprofit substance use treatment provider in the country, but we also, as you said, influence public policy. And in order to really combat this epidemic, we need to invest not just in treatment services and making them more accessible to people, but also in prevention, in youth services, and then in recovery services, because we know that when people suffer from substance use disorder and they go through treatment, that they recover and not just live but thrive in their lives. And so making sure that we have the supports for people in place, regardless of whether they live in a rural area or an urban area, they're poor or they're more affluent, that they have access to the whole continuum of services they need and that their family needs.
There is still much stigma around this issue of addiction. While doctors and experts understand it is a disease, much of the public does not and view addiction as a moral failure. How do you approach that situation?
Well, I think we do that anti-stigma work, and we focus a lot and talk a lot about stigma. We lift up people's voices who are in recovery, who have experienced substance use disorder, and we spend a lot of time educating people. We educate first responders, police officers, firemen. We educate legislators, members of Congress, and we try to do our part to bring the recovery community to the rest of our community so that people start to break down those barriers, sometimes one conversation at a time, and really humanize people and humanize their experience. And we think that that approach is really what's needed, that people need to not see each other as other. They need to see each other and see them as themselves. And so we work a lot on the community side, but also with a lot of education for people in particular in decision-making roles in our society.
How can addiction treatment be made easier than accessing opioids, either painkillers, heroin on the streets? For example, the addiction to nicotine has many channels of accessibility for treatment, but it seems like this particular opioid situation, if you're an addict, you will have to jump a number of hoops to get treatment.
Well, and that's a function of stigma and discrimination against people that we were just talking about that suffer from substance use disorder, that it really is about treating a person who's suffering from the disease of addiction just like you would treat a person who's suffering from any other chronic health condition like diabetes or cancer or otherwise, that there shouldn't be these systemic barriers to people accessing care and treatment. And frankly, that our doctors who see this every day are educated in the disease of addiction as part of their curriculum that they receive as medical students and as they're practicing physicians, so that they understand how best to treat people who are suffering from substance use disorder as well.
Has our attitude towards drugs in general changed? What other issues lead to the addiction to opioids besides the availability, both as prescription and in the black market?
Well, trauma is a big leading indicator of a person's falling into a substance use disorder. And really, I think the other social determinants of health. Really, substance use disorder is a risk factor across all different types of the social ways that our health and our healthcare is determined as individuals and as communities. So it's harder for a person to maintain stable housing if they have a substance use disorder. It's harder for them to receive education if they have a substance use disorder. And so it runs across all of the different ways that different types of your life experiences can impact whether or not you're predisposed to suffering from addiction.
Is this a uniquely U.S. problem because our society has decided that pain in any form should be treated and not tolerated? What do we know about this kind of addiction in other countries?
Well, we need to remember that the same drugs that we're talking about here, opioids, but alcohol, methamphetamines, they have been around society for the last 100 years, and people have suffered from addiction at great rates, not just in the United States, but across the world as a result of their use of these drugs for many, many years. What's unique about this and this epidemic is that it really started in doctors' offices and started as a legal form of pain relief that was, essentially a false sale to people who were in need. And that really started in the United States. That said, opioids have been around for a really long time, and people have abused them for a really long time. These were just marketed and sold in a way across the United States that didn't provide people the information they needed to make sure they knew the risks of them.
You work for the state government and now in the private sector. At what point the government of Minnesota realized there was a crisis? What was happening that all of a sudden you went from a problem to a crisis?
Well, people were dying. And our treatment beds in the state of Minnesota and across the country were starting to fill up with higher numbers of people suffering from opioid use disorder. So in the early 2000s, the number of people that were accessing inpatient treatment for opioids was very, very low. And over the course of the last several years, it grew to, right now, Hazelden Betty Ford serves about 25% of the people that are inpatient treatment have opioid use disorder and are there because of that. So that was really the first sign.
Well, we thank you very much, Emily. It's been a pleasure. Certainly, we will invite you back. We just have started this analysis of a very complicated situation now here in the United States. Thank you very much for your time.
Thank you.
Una corta pausa, estaremos de retorno en un momento.
Me recetaron Oxy cuando me lastimé el cuello. Empecé tomando el medicamento para sentirme mejor, pero después me lo seguí tomando. No sabía que sería tan adictivo. No sabía hasta qué punto llegaría para conseguir más.
La dependencia de opioides puede suceder después de solo 5 días. Sepa la verdad. Difunde la verdad.
Aquí continuamos nuestro diálogo desde Filadelfia, Pensilvania, con la profesora Claire Finkelstein, directora del Centro para la Ética y Leyes de la Universidad de Pensilvania. Professor Claire Finkelstein, welcome to the show.
Thanks for having me.
Claire Finkelstein es investigadora principal del Instituto de Investigación de Política Exterior. Es experta en Derecho Penal, Ética Profesional, Teoría del Derecho Penal, Ley Internacional, Jurisprudencia, Ley de la Guerra, Ley de Seguridad Nacional, Filosofía del Derecho, Filosofía Moral y Política. La investigación actual de Claire Finkelstein aborda las leyes y políticas de seguridad nacional.
Well, this crisis has cost the lives of over 450,000 Americans, many-fold the number of those that die in Vietnam. Are events like this one an evidence of an epic failure of the regulatory system in the United States in the regime of drug and manufacturer distribution?
I think that's true. As in all cases in which the public is exposed to serious danger, there is usually a governmental failure somewhere along the line. We saw this with cigarettes. We see this now with gun ownership. And we certainly see this in the case of the opioid crisis, where the FDA was really asleep at the switch in terms of the dangers of allowing drug companies to market opioids as heavily as the FDA permitted.
Lawsuits have been filed against pharmaceutical companies. Some defendants have offered multi-billion settlements. Other defendants already were sentenced or by the courts, like the recent case of Johnson & Johnson in the state of Oklahoma. $572 million were awarded. At this point, what do you think are the legal arguments, both for the prosecutors and those for the defendants, the level of manufacturers and those that prescribe the opioids?
There are a number of things to notice about the Oklahoma decision, which is such an important one in the trajectory of this litigation. First of all, what we saw starting a few years ago is cities and states becoming plaintiffs in the battle against opioid addiction. We have not really seen that kind of litigation on such a widespread and systematic level before. We saw plaintiff classes, but we haven't seen cities and states themselves becoming plaintiffs in the cases. And there were a lot of reasons to think that such cases would not succeed. The most challenging aspect of the cases had to do with proving causation. How can you prove that Johnson & Johnson, for example, is responsible causally for the level of opioid use that occurred and for the epidemic that ensued and for the amount of street drugs that the legal prescription of drugs then later produced. So causation was a major challenge. What was special about the Oklahoma case is that there was a nuisance law in place, and that helped to get around some of the causation issues. Now, we'll see how that plays out in future cases, but I think it sets a very important precedent for private manufacturers to start having to accept responsibility, and we will start to see settlements as more decisions of this sort occur, and as we feel the impact of them, since companies will want to avoid negative judgments and the publicity that those judgments bring.
So you were mentioning this issue of states and communities being involved, but this is a national crisis with sovereign consequences that may also impact some federal and state agencies for allowing this crisis to go seemingly unchecked. I'm referring specifically to the FDA, the Veterans Administration, and even the CDC for failing to protect consumers from this situation.
You're certainly correct in that. You understand that the drug manufacturers take the position that, well, we are marketing drugs that are legal, that we've been approved to market, and so why should we be held liable when the FDA, the CDC, and the Veterans Administration bear ultimate responsibility for deciding what is permissible in terms of drug marketing? I think there are a lot of arguments against that, but one does have to recognize the responsibility of these agencies. For example, the Veterans Administration was really in the forefront of prescribing these medications to veterans. Veterans have a very difficult situation in many cases because they are a vulnerable population from the standpoint of mental health problems, and they have chronic pain. So if a veteran walks into your clinic with chronic back pain or other pains because of combat related injuries, and they're not properly screened for mental health issues such as PTSD, and they're given opioids for the pain, their chances of becoming addicted to that medication are much higher than the average citizen who walks in off the street. They therefore are an at-risk population. The Veterans Administration had every reason to know that and to understand that, and should have been particularly careful in the use of opioids in this vulnerable population. We can say the same thing for the elderly. We can say the same thing for prison populations. And so we find that there are reasons why these agencies should have been more careful in the face of allowing such widespread prescriptions of opioids to members of vulnerable populations. And from there, the opioid addiction was able to spread considerably across the general population.
Well, and the war on drugs in the USA has at best had minimal success. What do you think are the legal angles that we should consider with the experience of the past for this kind of crisis, like the creation of drug courts? What other legal tools do we have?
Well, let me say that regulation of prescription drugs is absolutely essential, because what we have here is an example where prescription drug manufacturing and legal use of painkillers spread to a black market because of the high levels of addiction that those drugs caused. So if we think that there is a world of separation between legal prescription drugs and illegal drugs, we really have to rethink that. So our regulation has to be much tighter over prescription drugs. Second of all, on the back end, you asked about special courts. Veterans courts have, of course, long been dealing with such issues and have been functioning almost like social work agencies. And that really puts an undue burden on those courts, though I think veterans courts have been fairly successful in handling the special problems of veterans. But we can't go off and create a new special court every time we have a social challenge to deal with. I think when we have to create so many special courts, that shows that we haven't really gotten to the root of the problem and the regulation that we need to put in place. And therefore, we're trying to solve problems on the back end that should have been solved on the front end. So in general, I'm not a fan of special courts, though, as I say, I think the veterans courts have been fairly successful. Drug courts notoriously have not been successful, and it's very difficult to keep the criminal process separate from the process of evaluating drug offenders and trying to get treatment for them. So I think it's an enormous challenge for the criminal justice system. In the past, our greatest success in dealing with major public health emergencies and high levels of risk to large numbers of people comes from regulation. We see that with mandating seat belts in the 1960s, and the number of fatalities from car accidents just plummeted. Airbags, a similar result. We see that with regard to requiring people to wear helmets when they drive motorcycles, and I hope that we will see that again with gun control. Prescription drug safety needs to go the way of seatbelts, airbags, and helmets. We need to understand the levels of risk that we're imposing on populations and have sensible but aggressive regulation of manufacturing and marketing of highly addictive medications.
And yet, the biggest cases of overdose and death come from opioids that are in the black market, synthetic opioids that are imported like fentanyl. So, you regulate something on the industry level, but then you have this other complex situation of illegal drugs everywhere in the streets.
Well, once again, you have to understand the enormous growth in the black market of opioid type drugs as stemming from prescription drugs and the high levels of addiction that they caused. So we have a vast black market that came about because so many thousands upon thousands of people became addicted to prescription drugs. And by the way, that doesn't just mean people for whom those drugs were originally prescribed, but we know that teenagers could get into their parents' medicine cabinets and take fully legal prescription drugs that may not have been terribly dangerous for the parents themselves, but misused by those who could access them, they could be. And so we have a black market that was spawned, and then of course, higher and higher concentrations of opioids in drugs that were flooding the market in order to meet the demands of addicts. And so the crisis emerged.
Well, it's been an honor to have you and a pleasure. This is only the beginning of the journey and of the discussion. We hope to have you back again. And we thank Professor Claire Finkelstein for the time spent with us. We hope to have you back again in the program soon.
I'd be glad to. Thanks so much for having me.
Casi el 80% de las personas que usan heroína en Estados Unidos primero comenzaron abusando drogas farmacéuticas derivadas del opio. La sobredosis de opioides en el país se incrementó entre el 54 al 70% solamente entre julio del 2016 y septiembre del año siguiente. Ningún acto de terrorismo o catástrofe natural ha podido sacudir a este país en todos sus estratos de la manera que esta crisis lo ha hecho. El incentivo económico de los fabricantes de drogas hasta la cadena de distribuciones y médicos generaron una situación que fue aprovechada por el mercado negro de drogas. Hoy estamos en el ojo del huracán de esta tremenda crisis hasta una nueva oportunidad, cuando juntos exploremos el ADN de las noticias. Muchas gracias.